So a bad period, what does a bad period look like? So basically, if you are bleeding really heavily, you're having to change your pads every hour, it's kind of lasting longer than 7 days, you're having a lot of cramping, you're spending the first 2 to 3 days in bed, that's a really bad period. If you find that you've applied some of the things that I've mentioned, so let's say over a month or 2 months, you've addressed your gluten intake, you've reduced your sugar intake, you've introduced magnesium and B complex into your diet, and you're generally just staying a bit more active, lots of, belly massage, womb massages to improve blood flow. Usually, if that's just a simple sort of bad period, I say simple, but if that's just a bad period, usually those things will at least show you an improvement. You should see some significant changes by month 2 of really being diligent and being consistent with those changes. If you have introduced all those things that I've mentioned and some and more, and you've done all the testing and all of that stuff, and you're still having bad periods, or you're having spotting in between your periods, your pain feels more like barbed wire ripping through you, it's excruciating, you find you're bedridden for like a whole week, usually there's something deeper going on. And that's when I'll be thinking, okay, maybe this is endometriosis, maybe something more is going on, which even if you applied some of those changes, actually you would still see positive effects, just that it might take longer. Because when you think about endometriosis, essentially it's your uterine lining, there's shedding, but then there's no outlet. So they're kind of, you've got cells that have disseminated outside of the uterus, and they're maybe in your joints, so that when your shedding happens every month, you're having inflammation and there's pooling of blood in different areas in the body. So it would take a longer time to see changes happen. And so even with that, you're really looking at your gluten intake, things that are really causing inflammation, especially with the foods that we're eating. A lot of the breads that we're eating now, it's not the same as what we were eating 50 years ago. There's different types of additives now, contaminants, all of that. So you'd have to be a lot more careful with the type of foods that you're eating. I would say completely stripping gluten from your diet, really being careful about the sugars that you're eating. So even if you are going to be eating sugars, it's more fruit sugars, and it's things like berries that really have like a low glycemic index, but are so packed full of nutrients to support your body. That's how I would normally distinguish a bad period from other conditions.